We have roughly about 320,000 single-family homes in the city of Detroit, which is really one of the largest single-family homes in the country. And of course, we have the housing stock is the oldest, one of the oldest in the country as well. And because you have so many homes that are really in a deteriorated condition, the health effects of those deteriorated homes is tremendous.
The ASHHI funding has made it possible for us to do many important things in the community. Two of those. One is that we were able to address healthy homes hazards in 120 homes, and that means making those homes safer for children in terms of lead hazards, asthma, triggers, and home safety. And there's been a myriad of ways that that's helped that part of the community. Secondly, we've been able to work on the issue of enforcement, helping to make sure that property owners know what they need to do to make their homes safe, and that they know that they must make their homes safe.
Some of the differences of the local ASHHI organization, which is ClearCore Detroit, has made in the community really boils down to providing specific services to families that will help them to make good decisions about their living conditions. For example, the choice as to which home they're going to live in. And of course, some of that really has to do with their financial ability. But really, even in that narrow parameter, they can make better choices because now they're informed as to what conditions is going to cause problems for health problems for their family, or is going to exacerbate health problems.
As the program that works on healthy homes in Detroit, we are really in a unique position. As we know, the city's in a great stage of transition. There are many, many houses being torn down, and we are the voice for the houses that remain. So we want to make sure that in the city of Detroit that houses are made healthy, and really that those houses don't become the next set of houses that need to be demolished. So I think we are the voice that speaks for the houses that remain and the people that are going to stay in those houses regardless of the condition.
Because of the ASHHI grant, there's been a marked improvement on their service delivery to the clients that they come in contact with. Now through that grant has allowed them to develop tools that will help them to pinpoint conditions in the home that's going to really help the home occupants to make changes in their use patterns, to make changes in their ability to avoid hazards by proper cleaning, by proper approaches to how they really function as a family. And of course, that grant supported with other grants and other funding sources really have direct impact on and direct intervention on the homes that they're living in.
Community partnerships are the #1 way that we've accomplished our goals, and I have to say in our city that's on every level. That's on the policy level, and that's on the advocacy level, and also working in homes. We probably have 15 to 20 partners that bring resources to each home that we work on, and actually for every dollar we've spent in a home, we've leveraged $2 in partnership resources, and that might be a lead hazard grant or weatherization grant or an energy efficiency grant or a new refrigerator, a new furnace. So there's been a very, very robust partnership in Detroit that has worked very hard to make sure that this issue stays in the front of the political will of the city and also impacts the houses that we work on.
It also expands and allows them to have forums so that there's opportunity for educators to come in and really teach community persons, teach families how to better have a better living condition and avoid health hazards that affect asthma triggers and lead hazards and other health effects.
We work in homes in a target area, and there was a couple homes we were working on in the same block of a target area. On that block, we always, as always, replaced smoke detectors, fire extinguishers, and CO detectors. And a cluster of people lived in several houses. Well, a smoke detector went off in one house, made a loud noise. The children were in that house and young adults, but no adults. And many other people that lived next door and across the street heard that smoke detector, rushed over with the fire extinguishers we had put in those houses. And between the 4 houses, they put out the fire. And really, I think, saved that house and also helped those children from not being in a very dangerous situation. So it goes to show, I think, our ability to bring the community together, in this case, help a group of people in a cluster to make a real difference for that house and that block.